For 35 years, Boston MedFlight has been a familiar sight, traversing the skies and highways of New England. But the journey began by navigating an agreement between the consortium hospitals.
It was really through the leadership of many of our physicians who were chiefs of trauma at the time, coming together to say, we're going to be better off if we do this together. And in this space, is there a way we could figure out how to do that collaboratively versus competitively?
I was very strategic in terms of recruiting the first flight crew, nurses and paramedics. And I strategically took a nurse from the Brigham and a nurse from the General and a nurse from this, so the nurses are balanced. And we began flying in 1985 out of Logan Airport.
A far cry from the gleaming facility in Bedford that is the hub for a network of ambulance, fixed-wing, and helicopter transport, and a fitting tribute to critical care physician Dr. Suzanne Wadel, who led Boston MedFlight as CEO and medical director for 27 years.
Couldn't have done it without somebody like Suzanne in the driver's seat, basically, putting all the pieces together.
The most vital piece has always been the expertise of the flight nurses and paramedics.
On any given day, they can take care of a patient, who was a victim of a car accident on the side of the road, to taking care of a 600-gram neonate, and being able to deliver the care appropriate is crucial.
Already experienced critical care specialists, before they sign on, they constantly upgrade their skills in the simulation space.
The MedFlight crew brings a very high level of sophistication and training, often to the boondocks. When they're coming to a hospital, particularly at odd hours, they may represent the most capable healthcare providers in the building when they show up.
That was the case with Jeff Wish, who experienced a severe gastrointestinal bleed while on a family vacation. The nearby community hospital called for a helicopter.
One of the crew, who was a critical care nurse who I'm indebted to, as well as the rest of the crew, of course. As we were about to go into the helicopter, she said, let me just check your vital signs once more, Dr. Wish, to see how you're doing before we lift off. And at that point in time, she looked at me and I saw the expression on her face and she said, I can't take you. You don't have a blood pressure. And I said to her, Kristen, if you don't take me, I'm going to die, because unfortunately there's not that level of care here for me. I need a higher level of care at a major academic center. She confirmed that. I would not be here talking during this interview if it weren't for the incredible judgment and care.
The judgment and care, the training, and the technology are delivered on every call, whether on the ground, as with Boston MedFlight's fleet of critical care ambulances, or in the air.
It is a traveling intensive care unit. It is a mobile intensive care unit, a mobile emergency department. It is like bringing the hospital out into the community, out into the street.
Or, as in Cindy Wish's case, to Nantucket. A fall left her possibly in need of a chest tube. While a well-traveled sailor, she wasn't eager to fly.
The paramedic, the young fellow there, he said, are you all right? Do you need any more medication? And this is my great story. I said, no, but will you hold my hand? And I was so scared. And he reached out, and this young man held my hand the whole way to the Brigham.
We get positive comments every single day. Thank you. And those thank you notes are never, thank you for managing my mechanical ventilation during the transports. You held my hand during the transport. And that is incredibly powerful.
I still have my family, I'm still myself, so they kept me alive. They kept the oxygen in me and my brain's fine. You know what I mean? It's just like amazing.
I didn't realize how bad I was. But without their, I'm going to cry, without their services, I wouldn't be here.
They were literally miracle workers, that it was like angels from heaven came down and saved him.
I did a call to a schoolyard where a bunch of elementary children were run over by a car. And the child that I was taking care of was at the time the same age as my son. And I knew how critically injured he was. His mother was on scene, and I promised her that I would hold his hand until she got to the hospital. I've stayed in touch with him for 16 years, and I talk to him frequently.
We can teach people the medicine. I can teach people the medicine. I can't teach people to be a human being, and that really reflects on the quality of the people that we hire here.
Behind every transport are the maintenance staff who keep these aircraft in amazing operational order 24 hours a day, 365 days a year. It's our communications specialists up in the comm center who are available to us for anything that we might need while we're in the air.
All of the expertise, the equipment, the technology is available to patients regardless of their insurance status or ability to pay. If that's news to you, you're not alone.
I didn't even realize how lucky we were until I started doing stories with Boston MedFlight through the nonprofit and through generous donors throughout the area and around the country. They're able to support this and make this a real service that we're so lucky to have.
It's so important that we are able to care for them regardless of their ability to pay, because in that moment in time, in that critical hour, that's the last thing anyone should be thinking about.
Knowing that a lot of their ability of taking care of Bodhi that day came from other people's donations, we couldn't be any more grateful for that.
I think it's the best of healthcare, and I'm really proud that Boston Medical Center is a founding member and strongly associated with MedFlight.
35 years of selfless service, and the course of countless lives changed.
I think if we were to poll everybody here, we'd find all of us now have a loved one, a family member, or a friend whose life has been saved or dramatically impacted by having access to Boston MedFlight. So I can't think of a better object of philanthropy than this organization.
Those are 80,000 patients' lives, and when you extrapolate that to their friends and family, I mean, we've probably touched, 1 million people's lives over the last 35 years.
I'm sorry, if we didn't have Boston MedFlight, you wouldn't be here.